Hello and welcome everyone. Thank you for joining us for tonight's free webinar, Integrative Microneedling for Beautiful, Healthy Skin, featuring Diana Horowitz, licensed acupuncturist, and Amelia Vargas, licensed acupuncturist and licensed esthetician. Co-founders of EastWest Microneedling, L.L.C. My name is Todd O'Leary, and I have the pleasure to restart the free webinar series brought to you by Las OMS. For over 40 years, Las OMS has been, I'm getting tons of pings, although it must be it. For over 40 years, Las OMS has been supporting acupuncturists in every way possible. We strive to promote the growth of the acupuncture industry by providing quality products, great pricing, and the best customer service. With our free webinar series, we intend to provide educational opportunities taught by some of the industry's most renowned educators and practitioners. Let's take a moment to acclimate ourselves with the webinar room. To the right and at the bottom of the screen, you will see two tabs, questions and chat. And that's the chat I can hear right now. To connect with other attendees or notify us of any difficulties, please use the chat tab. At the end of the presentation, we will use the chat tab to post discounts and promo codes from Las OMS and EastWest Microneedling. If you have a question for the guest speakers, please use the questions tab. We will get those questions during the Q&A session at the end of the lecture. Please note, each webinar is recorded, and immediately following the conclusion of the webinar, you will receive a link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all our previously recorded topics. Now, let's introduce our featured speakers. In 2015, Amelia Vargas and Diana Horowitz discovered and started practicing motorized microneedling in Colorado. As facial rejuvenation acupuncture specialists, both trained in the Wakefield technique, they strongly shared a belief in supporting a patient's health with Chinese medicine during any aesthetic acupuncture process. Their passion for microneedling propelled them to create and teach a truly comprehensive microneedling seminar titled Integrative Microneedling for Acupuncturists. Their purpose to help acupuncturists successfully with integrity bring an exciting, fulfilling, and lucrative specialty to their acupuncture practices. And now I will turn it over to Diana and Amelia.
Thank you, Todd. Appreciate it. It's exciting to be here. Exciting to be back up in a webinar with LASA.
All right. All right, I'm going to step off screen. You guys have the floor.
All right, thank you. All right, welcome everybody. I'm Amelia Vargas, and we'll get started. I'm excited to be here. So what is microneedling anyway? Microneedling, if we get into the definition, is the penetration of tiny needles in the skin, which stimulate and create a healing response similar to what we know of as plum blossom in Chinese medicine. In recent modern history, it has been repurposed as a cosmetic treatment to stimulate collagen production and transdermal absorption. So microneedling is currently practiced by dermatologists, estheticians, and lay people all over the world, and its popularity is growing worldwide. It's also practiced among acupuncturists. And there's a lot of different terms for microneedling, and you can see there's, from the Eastern perspective, we have 7-star hammer, we have plum blossom. Other names in the Western perspective, the list kind of goes on there, but like collagen induction therapy, microchanneling, dermal needling. Of course, we know more commonly dermal rolling. And so this has become a really popular treatment. You will see that there are celebrities getting microneedling. It is being featured in a number of different big magazines like Vogue and InStyle, Elle. It's also often presented or featured on different shows like The View, The Today Show. So microneedling has gotten to be a very popular and hot modality. the big question for us as acupuncturists is how can it benefit our practices? So, usually the first thing people ask about is income, right? Microneedling is a really lucrative treatment, and depending on where you are, the typical cost of microneedling of what people charge for it can vary, but anywhere from like $250 to $650 per session. It's not only helping your patients to both look and feel better, but by incorporating microneedling into practice, you'll create a new income center with this lucrative specialty that's already really popular and mainstream. This modality taps into, and along that same line, into a very heavily marketed and researched service. So because so many different people are practicing it and it is so popular, a lot of this research is already done for us, and we don't necessarily have to do as much of the educating. People are learning about it very easily. So we get to tap into that market. If you do a Google search right now and pull up microneedling, there's you'll come up with anywhere from like 40 million to 60 million hits on microneedling. So it's considered to be not just a common practice, but also a non-invasive, results-oriented modality that's a nice alternative to other cosmetic surgeries or more invasive treatments. This is also a way to tap into a new clientele. So it is a simple truth that a lot of people end up looking for beauty services over health services. And this is an opportunity for us to provide both health and beauty, and for us to provide an education and an opportunity for clients to come in and maybe start getting a beauty service, but then learn about the benefits of acupuncture and how beauty is really a reflection of internal health. This is also very results-oriented treatment. So your patients will feel the results of healthy skin, they'll see clearer skin, and then in combination with the body points and acupuncture, they're gonna feel better as well. It also combines really well with other acupuncture modalities. So it's easy to work it into doing if you're doing facial rejuvenation acupuncture, regular body point acupuncture. You can incorporate it with tuning forks, acupressure, gua sha, facial cupping, and the list goes on. It also is a really nice opportunity to provide more retail opportunities for your clients. So you can retail skincare products and supplements that are going to be supportive of microneedling. And that can mean, besides boosting your own income stream, it helps clients to have a take-home, a homework to do in between and for their self-care.
Hey, thanks, Amelia. I'm Diana Horowitz, and I'm going to introduce how microneedling is Chinese medicine. So when I first saw motorized microneedling back in 2015, I was working at a spa in Denver, Colorado, and the spa owner brought in a microneedling device rep for the estheticians to learn microneedling. And I thought to myself, wait, needling? That sounds a lot like acupuncture. Actually, it looks a lot like plum blossom technique. So I kind of crashed their training, and I was really impressed by it. And then I found out soon afterwards that Amelia was also asking those same questions, like, is this acupuncture? And I was so struck by how closely it resembled plum blossom therapy, which is an acupuncture technique. So plum blossom therapy is firmly rooted in the history and philosophy of Chinese medicine. And our source of information is the book Chinese Plum Blossom Needle Therapy by Jiang Meiquan. And it's the only book we could find that's been translated into English about plum blossom therapy. And it says, the plum blossom therapy, acknowledged as part of Chinese medical legacy, is a therapy of shallow insertion with multiple needles. This therapy has existed for over 2,000 years. In the Yellow Emperor's Inner Classic, there's a recording of superficial needling, scattered superficial needling, and quick shallow needling, which have laid the foundations for the development of the plum blossom needle therapy. And And so many acupuncture schools currently teach plum blossom therapy, and maybe you're learning about it as a student right now, or you already use it in your acupuncture practice. Next slide, please.
Yep. Oops.
So, it works, since it's another form of acupuncture, really, it works the same way. Diana,
hang on one second.
Okay.
Todd, can you help us with the slides that they're just kind of sliding back and forth here? I'm not sure why.
I can keep going. All right. So it basically stimulates healing from the exterior to the interior. And if you think about it in terms of what we learned in acupuncture school about differentiating syndromes according to the 8 principles, for example, pathogenic factors such as wind or cold can invade the meridians and the collaterals. And over time, they dive into the Zhang Fu organ systems. And diseases caused by an exterior pathogen it begins in the exterior, right? But in time may affect the interior. However, this interior-exterior relationship can also show up the other way around. So imbalances in the Zhang Fu can appear along the meridians and the collaterals and cutaneous regions of the skin. And as energy detectives and diagnosticians, we need to pay a lot of attention to where and what kind of skin issues arise so that we can treat the imbalance in the organ systems with our medicine. All right. So we're going to go over the TCM functions of plum blossom therapy.
Can I have you pause for just a quick second?
Yeah, sure.
Amelia, do you have that link to go back? Because I don't know why this is breaking out like that. I'm trying to even eliminate it and it won't go away.
What if it goes to an addition, further ahead, will it stop? Is it just between those two, or is it just all over the place?
Oh, it's gone. All right, let's try and get it again. Let's see. Is it under here? Oh, this thing is crazy. Sorry, folks. Bear with us. Wouldn't see that one coming, huh?
I like the emojis. Thank you.
Yeah.
Thank you very much for that. No idea. Amelia, do you have that link to go get it from?
Yeah, let me try sharing it again and see.
Okay. Do a little song and dance while we wait. Okay.
Oh, thank you.
Okay, let's see. Uh-oh.
Wow, that's crazy.
Oh, celebrations. I can keep going. I'll just keep going while you figure that out, okay?
Okay.
Cool. All right, so we're going to talk a bit about the TCM functions of plum blossom therapy. Since this webinar is for licensed acupuncturists and students, we're going to kind of assume that you understand the following TCM functions for plum blossom therapy. They are promote blood circulation to remove obstruction in the meridians, to disperse swelling and remove dampness, to stop pain and dissipate blood stasis, harmonize the yin and the wei, reduce heat and toxic substances, and eliminate pathogenic factors such as wind and heat and cold, etc. And so since microneedling is a form of acupuncture, it can heal the skin locally as well as work systemically through the acupuncture channels and organ systems. And aside from facial rejuvenation acupuncture, we don't know of any other modality that promotes beauty by addressing the health of one's body, mind, and spirit. And so we really pride ourselves in teaching an integrative approach to microneedling in our courses. So what does microneedling do from a Western perspective? Well, it increases transdermal absorption of skincare products that heal the skin. And we're going to get more into that later. And then the derma roller or stamper. So the roller rolls along and the stamper has more of a stamping action, or a microneedling device that's a electronically motorized device. It looks a lot like a tattoo gun. It creates microchannels in the skin, and that prompts a microtrauma that stimulates the production of new collagen and elastin, which can improve the thickness and the smoothness and the brightness of your skin. And we at EastWest Microneedling believe it's important to understand the layers and the anatomy of the skin, and also the Western mechanism of microneedling, and know about the wound healing cascade that microneedling causes. And that helps you to understand the needle depth, which is most beneficial for treating different types of syndromes, and the frequency and the number of treatments needed to bring the most benefit to your patients. We devote a good amount of time to these subjects in our courses. We also bridge Eastern and Western philosophies and show how they come together in relation to microneedling. So for us Eastern medicine practitioners, harnessing the body's own natural healing response is really second nature. It's part and parcel of our work and our approach, because we treat the whole person. We treat the physical, the emotional, the spiritual, and through the qi and the jing and through the meridians, and we make connections between the different organ systems. And so the Western medical industry is starting to appreciate this perspective in their own way, though I have to say they are quite behind us. And because they've been studying the subtle connections within the body that reveal how interconnected the body really is. And I'm talking about the biosignaling of proteins, and the work done by a Canadian dermatologist, Dr. Lance Setterfield. And he's one of the forefathers of modernized microneedling. And so he's kind of steering the Western microneedling community to understand that less is more, that you don't need to bludgeon the skin for it to regenerate, and that lighter stimulation can activate the production of collagen and elastin beautifully. So next we'll talk about wrinkles. So here's some of the skin conditions that microneedling really works well with. And wrinkles, so let's talk about some of the causes of wrinkles. Well, aging. Well, that's obvious. It's a fact that as we age, our skin naturally becomes less elastic and more fragile. And that's due to decreased production of natural oils that can dry your skin and make it appear more wrinkled. And then also fat in the deeper layer of your skin diminishes, which causes loose, saggy skin and more pronounced lines and crevices. And smoking can have an impact. The combination of heat and dryness can create yin deficiency or excess heat. And we know that smoking is damaging to both the energetic functioning of the lungs, which controls the health of the skin in Chinese medicine, and the organ itself. And so just know also that smoking cannabis is equally damaging to your skin as smoking tobacco. And then there's, if we could just move the slide over to wrinkles, please. Okay, then there's dehydration. So this can arise simply from just not drinking enough water. And it can also be worsened by living in an arid climate, such as Colorado, where Amelia and I live. We tend to see a lot of yin deficiency and dryness patterns in our acupuncture patients here. Then there's poor diet. Your skin needs several essential nutrients to keep it healthy, such as essential fatty acids and a variety of antioxidants in the dermal layer. My favorite nutrition book that combines a modern understanding of nutrition with Chinese medicine is Healing with Whole Foods, Asian Traditions and Modern Nutrition by Paul Pitchford. There's great information in there about how to keep your skin healthy through nutrition. Then there's sun damage. It's a primary cause of early wrinkling and sagging, and its exposure to UV light just breaks down your skin's collagen, elastin, fibers, and connective tissue. And then lastly, there's repeated facial expressions, which are beautiful, right? We love to express ourselves. So facial movements such as squinting or smiling, they lead to fine lines and wrinkles. And each time you use a facial muscle, a groove forms beneath the surface of the skin. And as skin ages, it loses its flexibility and is no longer able to spring as easily back into place. And then these grooves over time become permanent features on your face. So Mary Elizabeth Wakefield, acupuncture facial renewal expert, she's told me that she considers wrinkles to be the marks of having lived. And that's a beautiful thing. So wrinkles usually appear around the lips and the eyes and the forehead, where the skin is naturally thinner and where we tend to make these habitual expressions. And from a TCM perspective, it's the result of qi and blood deficiency and longstanding yin deficiency. So now we'll move into saggy skin. And this is another top reason why people seek out microneedling. So the causes is that it can develop due to the loss of elastin, which gives skin its tensile and taut quality. It can develop due to the normal aging process or nutritional deficiencies or dehydration, sun exposure, and also a really one that is not involved with wrinkles as much is rapid weight loss. And it can occur all over the body. It's most noticeable around joints, such as the elbows and the knees and the jaw, because skin in those areas are repeatedly stretched over time. And from a TCM perspective, it can indicate yin, yang, and qi deficiency, especially spleen qi deficiency, as the health of the spleen is reflected by the quality of the flesh. And so microneedling can help it is better at treating skin than the underlying muscle. So sometimes if the underlying muscle is weak, you can combine it with facial rejuvenation acupuncture or facial exercises. And of course, you want to help with the underlying TCM pattern, which is you want to help strengthen your spleen, your patient's spleen qi. And even though it's outside the parameters of this webinar, microneedling can address sagging skin all over the body. And then there's acne. So acne occurs when your hair follicles, if you could please move, there it is, thank you. When they become plugged with oil or dead skin cells. And so from a Western perspective, we're dealing with excess oil production, usually caused by excess hormonal activity or stress. The hair follicles get clogged by the oil and the dead skin cells, and then the bacteria grows and inflames the area inside the pore. And it can present in different ways, whiteheads, blackheads, pimples, and cystic type inflammation, usually on the face, including the forehead, the cheeks, the chin, jawline, neck, also the chest, upper back, shoulders. And as we know, it's most common among teenagers, although it can really affect people of all ages, and often adult women going through hormonal changes, possibly menopause or perimenopause, who then get a flare-up of hormonal acne. And from a TCM perspective, we're looking at patterns such as heat, dampness, liver fire, kidney yin deficiency, flaring with heat up to the face, especially for some of these people going through menopause. And at EastWest Microneedling, we think it's really important that treating acne is paired with internal balancing acupuncture and lifestyle recommendations such as herbs, dietary changes, stress management. And just remember that the skin is like a map to the internal body. So flare-ups of acne and dermatitis and eczema along the meridians can give you information about what patterns may be going on internally, because those are all itises too, right? Inflammation. We're going to get into appropriate skincare products in a moment, but it's important to educate your patients about not using classic harsh skincare acne products for drying out the skin, such as benzoyl peroxide, which can tend to irritate. And even though they can temporarily make the acne better, ultimately it makes it worse, especially if they live in a dry climate. And we talk a lot about this in our courses. And the next slide is about hyperpigmentation. So that's a darkening of the skin. It can be caused by sun damage, inflammation, all other skin injuries, including acne vulgaris, actually. And it's caused by melanocytes that produce excess melanin or color when stimulated by UV light. And it really affects the areas that are most exposed to the sun, such as the face, the chest, and the backs of the hands. And so there's a couple of types of hyperpigmentation, and they include like dark spots, sunspots, liver spots. Those are mostly caused by sun damage or inflammatory hyperpigmentation, and that's caused by an inflammation or an injury to the skin, such as acne or a skin wound. And that can have like a red coloration in addition to the brownish coloration, also depending upon skin type. Then there's melasma, and that's caused by hormonal changes and imbalances in the body. And it classically presents in these symmetrical patches on the face, and sometimes it's called pregnancy mask. And it can be exacerbated by sun exposure. So from TCM perspective, we have liver qi stagnation, hormone imbalances, buildup of toxins in the skin, and qi and blood stagnation. And just as an aside, hyperpigmentation is a more difficult skin condition to treat, and it does require more sessions to lighten it than other conditions, but it can be an effective alternative to lasers and such. And then let's move to contraindications. And so while we're not going to spend a lot of time on this, we want you to know that there are numerous contraindications to microneedling, and it's important to be aware of what to avoid, both for your patient and for you as a practitioner. And so tonight we're just going to go over 6 of our list of 13 contraindications. So one is active herpes simplex. If they have that around the mouth, you want to give it a wide berth or wait until it has abated. Uncontrolled migraines and headaches. So facial microneedling, it just brings a lot of qi and blood circulation to the head, which is great, but it can actually trigger a headache or a migraine if you don't energetically ground the patient with full body treatment. So you should help your patient who gets chronic headaches or migraines to resolve them for a significant period of time before they start microneedling. And then there's pregnancy. Well, we want to focus on the health of the mother and the pregnancy, and to bring qi to their uterus. And so you'll get some inquiries though from expectant moms who want microneedling while they're not allowed to get Botox. So just say no and help them during their pregnancy, if that's what you do in your practice, and then schedule microneedling after they give birth as a reward. You'll want to avoid microneedling over moles or skin tags and various lesions. You want to identify any skin irregularities before microneedling to avoid and work around them with a wide berth. And so there are really 4 main different types of skin cancer. There's basal, squamous, and Merkel cell carcinomas, and then there's melanoma. And melanoma is an aggressive skin cancer. And it kind of looks like an irregularly shaped dark mole or freckle. And so we never want to go over anything like this with a microneedling device. So while acupuncturists are not dermatologists, we do help our students to familiarize themselves with skin cancer's characteristics and to take a photo of anything suspicious and give that to your patient for them to track themselves and possibly go see their dermatologist. And then lastly, there's certain types of scars. So just even though microneedling can be very effective on some types of scars, on other types of scars, it can actually make them worse. So we really need to differentiate between those. That's it for me.
Great. Okay, let's see if I can get this to the next slide. There we go. So getting into skincare products. First of all, something to understand with microneedling is that it significantly, it raises the rate of absorption into the skin. So you can get into different, like people have different percentages that they throw out there. And the most important thing to understand is that it really, anything that you put on the skin is going to absorb deeper into the skin. So we kind of like to think of it like if you're aerating your lawn and you put clean water on your lawn afterward. You don't want to use pollutants. You don't want to use nasty chemicals. Your skin's the same way. You're opening it up. You're creating these little perforations. You don't want to use anything that's going to irritate the skin. It also means that if somebody's allergic to any ingredients, that will flare up significantly more than just if they were to put it topically on their skin without microneedling. So you need to be aware of allergies and ingredients that you're using and make sure that you're using clean, organic, non-reactive ingredients. Go here. So in a microneedling treatment, there's going to be some different opportunities for products to use on your clients. In the beginning, you want to cleanse their skin very well. Again, you want to use a gentle, organic, chemical-free cleanser. You don't want it to have any acids or harsh ingredients or anything that they could be allergic to. A safe bet is something like an aloe-based cleanser, or there's a lot out there, but clean. You can do an exfoliant, that's optional. And again, I'm going to keep saying this over and over, but you want it to be gentle. You don't want this to be too abrasive. You don't want it to be one of those really abrasive scrubs. If it's a scrub, then something like jojoba beads or something very gentle. If it's an enzyme, then you can use a fruit enzyme that is very mild. It does help to remove a little bit of that excessive dead skin barrier before microneedling, but you just want to do it in a way that is non-invasive. For toners and hydrosols, this is a really great way to prep the skin. Some examples are colloidal silver, there's witch hazel, and then any kind of organic hydrosol, all kinds of different herbs in hydrosols, right? But rose, lavender, chamomile. This is a really nice way to cleanse the skin and get it prepped. A lot of people use isopropyl alcohol to prep the skin. I find that a little bit too harsh and too drying, so I prefer to use one of these options instead. Colloidal silver is antimicrobial, anti-inflammatory, it's wound healing, and then depending on the herbs that you're using in a hydrosol, you're going to get similar effects as well. Next, which is a common thing that people use, is some form of analgesic. So the typical is a type of numbing cream. People will use either a lidocaine, a topical lidocaine, or a BLT, which is benzocaine, lidocaine, tetracaine. You need to know the scope of practice for acupuncturists in your state as far as whether topical numbing creams are within your scope. I personally prefer to use CBD oil. So I find this to be a really great alternative to numbing creams. Even if I'm allowed to use numbing creams, if somebody really needs it, that's one thing, but I really prefer to go with more of the anti-inflammatory and something that's going to be good on the skin and that also has a natural analgesic effect, so it kind of just takes the edge off. I know that LASA OMS has a lot of different tinctures, which even though tinctures are internal and you can do internal CBD, but topically is what I'm talking about in this situation. And you can even use a nice, clean, pure tincture topically on the skin and have that be kind of that analgesic effect. Now, during microneedling treatment, a lot of people use like stem cells, hyaluronic acid, some other anti-inflammatory ingredients that are going to be used to help support the healing response of the skin and the collagen production of the skin. And it's important to keep the skin well hydrated. So you can, green tea oil, mushroom oil, sea buckthorn oil, CBD. There's a lot of different ingredients out there, and we get into deciphering a lot of these in our course. Some people during the treatment have a philosophy of only using what naturally occurs in the skin, like a growth factor or stem cell serum or hyaluronic acid. I think the most important thing is just really being aware of possible allergens and allergic reactions. So there's green tea oil is wonderful, and as long as somebody's not allergic to that, it can be a wonderful combination with microneedling. Then in between your microneedling sessions, you're going to want to send your patients home with some products and have them doing their own home skincare routine to help support their skin in between treatments. So key guidelines, you want to stay away from harsh chemical ingredients. I'll say that over and over again. You want to focus on ingredients that are going to be supportive to that cell turnover, to that hydration, to reducing inflammation, that are healing for the skin. Ingredients that are also high in antioxidants are going to be nice because that fights free radical damage. Also, if they have vitamins and minerals, you're going to get those nutrients into the skin, which is supportive of strengthening the skin. And then there's a lot of different ingredients that are going to target different individual skin needs. So for example, inflammation, or if somebody has acne, CBD is a wonderful one for that, or dehydration, hyperpigmentation. Then there's certain ingredients that are going to target those a little bit more. In general, a regular skincare routine that works for people doesn't have to be complicated. It could be like a gentle cleanser, a gentle exfoliant, and then some form of treatment serum and some form of hydration. I personally prefer oil hydrations. I find them to absorb better into the skin, and they're also very balancing for oil production and dryness. This is a great opportunity to sell these products to your clients and have them using the right things and educating them. So some of the ingredients that we love, there's CBD, there's green tea, reishi mushrooms, sea buckthorn, calendula, pearl powder, rose, jojoba, argan. There's the list. It goes on here. So first, getting into CBD. When I first started using CBD, I was kind of resistant because of the hype on CBD. But I found that it has a very broad spectrum of who it can be beneficial for. And so I got on that train. It contains high levels of antioxidants. It's anti-inflammatory. It's very hydrating. It's going to support cell turnover. The antioxidants are going to help fight free radical damage and collagen breakdown. It has vitamins A and D, which helps promote that cell regeneration. It helps boost elasticity and collagen. It balances sebum production. So it's what they call non-comedogenic, which means it doesn't clog the pores. So if someone does have oily skin or clogged pores or acne tendencies, it's actually going to help move that oil out, and it's not going to clog their pores. It's high in omegas. It nourishes the yin, nourishes the blood, clears heat. And then there's also the whole response with CBD and how it attaches to the endocannabinoidal receptors. We have those in our skin. So that by doing that, it creates a cell turnover response and helps our skin cells to regenerate. Okay, so green tea oil. This, of course, in the East is a famous ingredient and herb and tea. It is also known as camellia oil, and it's wonderful for UV damage, acne, of course, reducing signs of aging, inflammation, partially because, it's anti-inflammatory, but also it's really high in antioxidants. It's very hydrating. So this is a wonderful healing ingredient for the skin. On top of that, it's protective of the skin from UVA and UVB damage. Mushroom oil is another one, and this is becoming more popular and more cutting edge in more recent years. You'll find different products with either reishi mushroom or chaga, or the list goes on as far as mushrooms go, and each mushroom has a little bit of a different quality. So some are a little bit more for hyperpigmentation versus hydration, and we get into some of that in our course. But it's, in general, they're high in antioxidants, beta-glucans, vitamin D, and selenium, and just wonderful free radical fighting, cellular turnover, collagen production, anti-inflammatory, also brightening. It's a really fun ingredient to use. Some additional ingredients that are nice to use in between treatments. In varying, a lot of these are common ones. You'll find these in a lot of different skincare products. So most of these, sea buckthorn, pearl powder, calendula, rose, jojoba, argan, a lot of these are going to have anti-inflammatory qualities, antioxidants. Many of them have antimicrobials or antifungals. The sea buckthorn is also, it improves collagen, it improves collagen production, it improves blood circulation and oxygenation. And that one also is one of those non-comedogenic oils that doesn't clog pores. Pearl powder is great for evening the complexion and hyperpigmentation. It has the amino acids and the calcium and trace minerals. Calendula, calendula is a really nice anti-age. I mean, it's healing, but it's also a really nice anti-aging ingredient. Rose is another one of those. It has the cell turnover. It helps to stimulate that cell regeneration response. Jojoba is a very common base oil, very hydrating, and also helps with collagen synthesis. And then argan oil. This is anti-inflammatory, of course, all the antioxidants. This can be another base oil, and it's known for anti-aging effects, and for it also helps with rosacea and acne as well. So I know a lot of these ingredients I have seen, I've looked through a lot of Lhasa OMS's products, and I've tried some of them, and I know that there's a lot of these ingredients in their products. So after this, it's worth checking out. Good stuff there. So products to avoid. This is a big subject. We're going to scratch the surface here just a little bit. Biggest thing is chemical preservatives and harsh ingredients. So as Diana said earlier, the peroxide, there's also here, there's acids, there's peels, retin-A, retinols. All of those can be irritating to the skin, and you want to make sure to avoid those, definitely with microneedling for sure, and some of these in between as well. A lot of these people don't need to be putting crazy active harsh ingredients on their skin. Get it healthy on its own. Another one that is kind of a funny and controversial ingredient is the snail slime. So there are really such things as snail facials and snail slime in combination with microneedling. And it basically is an enzyme that is similar to peels, but it can be harsh and it can be irritating to the skin. So it's better to avoid that one. Also, there are ingredients that we typically know of that are great for the skin, but you wouldn't want to combine those with microneedling. And we get into all of that in our course.
All right, thanks, Amelia.
Yeah.
So we're going to talk a bit about our integrative microneedling holistic protocol and what that's about. So at its foundation, we want to foster beauty by honoring and treating the patient's whole body, mind, and spirit. And we just want to thank Mary Elizabeth Wakefield, who's a facial renewal trailblazer, for sharing her unwavering belief in following this path. And so then we created a flexible, holistic microneedling protocol. And that our intention is that practitioners will view and treat their patients holistically using the acupuncture styles and adjunctive therapies that resonate most with them. And, you know, we all have our different backgrounds and level of experience with acupuncture and with the specialty of facial acupuncture. So you basically start where you're at, right? And then you already have plenty to bring to the table. And in truth, Amelia and I learn a lot from our students all the time. And that's what makes us so excited to teach. And that's what makes teaching so fulfilling for us. So here's an example of the kind of testimonial that we want acupuncturists to get from their integrative microneedling patients. I started getting integrative microneedling sessions with Diana 6 months ago. I've had 5 treatments with her, and after the very first one, immediately saw an improvement. My skin looked plumper, firmer, and had a glow I had not seen in a long time. Her care and attention to my overall health is what sold me on going with her approach rather than microneedling with a dermatologist. You won't just get a facial, improved skin, and radiant glow. You'll also experience overall health benefits, such as improved sleep, that holistically support your entire being. I highly recommend her services. It's from one of my longstanding patients. All right, next slide, please. So our logo represents our integrative approach to microneedling and skincare. And on the left, you'll see an image of the plum blossom and plum blossom technique that it represents. And then on the right, you'll see an image of the spiral, which represents the microchannels and the DNA spiral within the Western philosophy. And in the middle is a needle. So next slide.
It's all a very delayed effect. There we go.
And so what will you need to practice microneedling? Just to give you a quick idea of those supplies. This list gives you a sense of the tools and the modalities that we incorporate into our integrative microneedling protocol. So some of these supplies are, you're going to want at least one of these devices, right? You're going to want either a motorized microneedling device, and this is a more significant investment, and we go through the different types of devices in depth in our courses. And you'll need disposable needle heads for your device. And then you can use either a derma roller or a derma stamper. You'll want ear seeds or press needles or magnets. And we recommend starting out with these options and then moving into acupuncture needles if your patient feels comfortable with them. And then you need your facial products. Like as Amelia described, you need that cleanser, exfoliant, toner, analgesic facial serum or oil. And I understand that L.A.C OMS is having a sale on all facial products right now. And then there's some optional supplies. So you have aromatherapy, and I love aromatherapy. I blend it into all of my treatments, but so essential oils for relaxation and grounding in particular. So our favorites are frankincense, lavender, and vetiver. And so you can place a drop on the tip of the nose and the sides of the shoulders and the soles of the feet. And then there's the tuning forks. So this is an art and science in and of itself, really. And it's a beautifully integrates with microneedling. So, and we highly recommend studying with Mary Elizabeth Wakefield and her partner, Michelangelo, to learn about it. And you would want to start with the mid ohms and the low ohms and get an activator to help avoid bruising your shins. You never want to knock those things on your legs. And then a heating pad for the abdomen, or just a mylar or a silk blanket, just something cozy, because people can get a little cold with microneedling. And then jade rollers or gua sha facial tools or facial cups to use in the whole process. And then acupuncture needles for the body. And then you just have your basic equipment. You have a crock pot or a towel warmer or a caddy. You have warmed wet facial towels. You have cotton rounds or squares and disposable gloves and a non-plastic bowl for water. All right, next slide, please. So here is a little demonstration of our integrative microneedling protocol in action. And this video is of Amelia giving a treatment at the J Lounge Spa in Boulder, Colorado, where she works. We created it for some social media purposes. Let's see if it works. Thank you.
All right.
So you can insert lots of different yummy products into that, incorporate into that treatment. And then let's talk about how can we integrate microneedling into our acupuncture services. So in our courses, we outline 6 different ways to incorporate microneedling into an acupuncture and or facial rejuvenation acupuncture practice. I see them as like variations on a theme in classical music. And they're designed to be as relaxing and restorative as listening to classical music, also invigorating too. So here are 3 of the 6 protocols. There's motorized microneedling standalone treatment, and that's really our signature treatment. It combines motorized microneedling with full body acupuncture, possibly aromatherapy and vibrational therapy, and it supports your patient's constitution and their internal patterns. Then we have derma rolling or stamping standalone treatment, and that is very similar to the above, but it swaps out the motorized microneedling with derma rolling or derma stamping. And then number 3 is derma rolling or derma stamping. So that it's incorporated into the facial rejuvenation acupuncture process. And so in our courses, we go into depth about how long each treatment should take, the recommended frequency of treatments, the benefits and the downsides of each treatment, and pricing considerations. And Amelia and I realized that prospective patients really needed a clear and complete idea of each possible treatment scenario to decide on the best course of action. So we created this chart and has all that info about the 6 treatments. And then we made it into a chart for our students to adapt and use during their own microneedling intake process. So remember, microneedling treatments have a high price point, and it's super helpful for patients to know exactly what they're paying for and how are they investing in their health and the health of their skin.
Yeah. Thanks, Diana. So we just wanted to give you a little glimpse of what we go into in our courses. We do an in-person course, we do an online course, and it's really our commitment and our passion to go deep and to have it be very comprehensive. We get into the history and philosophy and mechanisms of microneedling, benefits, the skin syndromes, as well as contraindications, skincare products, interfacing with other aesthetic treatments, which is really interesting. Our holistic protocol with we do demonstrations and practicums, both in our online and our, of course, in our in-person as well. And in fact, in our online course, after you've completed that course, we have a practicum option afterward that is over Zoom, and we're observing people practicing and giving feedback and engaging with them in that. So moving on, we go into microneedling device comparisons, how to incorporate the different forms of microneedling into your practice, managing patient expectations, navigating legalities and scope of practice, and business marketing tips. You also get a comprehensive resource guide, supply list, adaptable documents for your practice, derma roller and a derma stamper during the in-person seminar. Our course includes, so the online course has 2 detailed treatment protocol videos, both one for microneedling and one for derma rolling. And then that practicum option class to do afterward. And then in person, we do just small groups and ample time to practice techniques.
Yes. Yeah, we really want you to know that you know what you're doing. We want you to have that confidence. So as a thank you for listening and for joining today, we've packed this webinar with some promotions just for L.AC viewers. And the first is our in-person seminar. And we have greatly missed teaching. during the pandemic. So the next one that we have is on September 10th and 11th in beautiful Boulder, Colorado. It's 2 days, 14 NCCAOM CEUs. And the class size, as we said, is small. It's limited to 16 people so that you can get ample practice and time and attention. And we're giving a very ample 20% discount on this class through August 11th. We still have a few openings and we'd love for you to join us. And then we have an ongoing online course, and that is 11 NCCAOM CEUs. That's asynchronous learning. So you just learn, we give you 6 months to learn it at your own pace. And we're also giving a 20% discount through August 11th. And then what's also very particular to this webinar is that the first 5 webinar viewers who register for the course, for the online course, will win a free 1 hour and 15-minute online practicum class with us. And that is valued at $75 each. And we'll let the winners know who you are on August 12th. So please do go to our website, and you can use this discount code EWMN LASA 20 and for checking out at both courses. And then after the webinar, please feel free to contact us with any questions. We really love questions. We ask a lot of questions ourselves. And on that note, we're ready to answer your questions now.
Thanks, Diana. Thanks so much for joining us.
Ladies, I can't thank you enough for what a wonderful presentation you gave, even with all those gremlins in the machine. I could not believe it. The 3 of us were talking about this prior to the things, what could possibly go wrong. Well, we figured it out. Unbelievable. Yeah. Well done. Very well done. Thank you. There was a lot of activity. You did miss all these good comments people are posting in the chat, but let's get right into the questions. And let's see the first one. Oh, now the questions are firing up faster. Joanne writes, do you have any experience treating vitiligo?
Treating what?
Vitiligo.
Vitiligo.
Oh, vitiligo?
Oh, thank you very much. Vitiligo.
Amelia, you want to answer that one?
Treating that?
Yeah, typically vitiligo is not a great one to treat with microneedling. There's a lot more of internal things to deal with vitiligo. I have seen that people will do some microneedling to kind of soften the lines a little bit, but it's really not going to produce more melanin in those cells.
Okay. Lori asks, in treating, I hope I get this right, melasma?
Mm-hmm.
Okay. Number 1, do you find that infrared or near infrared light is helpful to add to microneedling?
I love using the LED infrared light. I use the Saluma, but it's that combination of the blue, the red, and the near infrared. It's awesome with microneedling. Yeah. And it helps with melasma and hyperpigmentation as well.
Great. And then number 2, which herbal formulas do you recommend?
Oh, that's a deep question. And it's just that's going to really depend on each individual patient. So I less so do formulas like in a broad term for the skin and more so based on their patterns. But as far as there's also general supplements that are nice, probiotics and digestive enzymes and things that support the digestive system.
Okay, great. Lisa Horton writes, what types of scars should you not microneedle?
We are doing that as a teaser, but I guess I can say.
Come join our course.
We'll learn a lot more about it in our course, but keloids are the ones that are, it can produce more of the keloid tissue and make it grow rather than dissipate. So, yeah.
Okay. Hillary asks, how do you feel about calendula hydrosol after treatment?
Yeah, calendula is wonderful. And again, as long as you know that the patient doesn't have an allergy to the calendula plant or in that family, then it's a wonderful healing ingredient to use.
Okay. What about frankincense hydrosol? Have you tried that?
Mm-hmm. I have.
And?
Yes, I believe the Musler Ball line has some frankincense in their hydrosols, and it's divine.
Oh, good.
Mm-hmm.
Excellent.
Yep.
In general, are essential oil diluted effective or too strong right after treatment?
The general consensus would be that you don't want to use highly concentrated essential oils right on the skin after microneedling, because it is so high concentration that that allergy could be stronger. Each product is going to be a little different, and how it's, what's in it and how much. So there can be some variation, but you do have to be careful with essential oils.
Okay. Susan Myers writes, I've read an article stating the importance of avoiding microneedling based that it actually causes ongoing invasive damage, such as collagen damage and scarring, both internal and external, and that continued cuts to the same area will cause worsening scars, both internal and external. Do you have some input here?
I've seen that article. I've seen there's probably 2 articles that I've seen that write about the microneedling taking away the collagen from the skin. Both of those articles are written by people who are selling skincare products. So there's a little bit of a bias to those. And if you think about acupuncture and you think about facial acupuncture and how we're inducing a healing response in the skin, we're not taking collagen away from the skin. We're not borrowing that collagen, like as the reserve that some of these articles are saying. We're giving a stimulation and a healing response and blood circulation to the skin. Yes, there are certain techniques of microneedling that can cause some tearing or damage. So there is a right way to do it. There is things to be aware of. But yeah, it's good stuff.
I have to agree with Amelia that a lot of it can depend upon how frequently you're doing microneedling. You can actually do it too frequently, especially with the motorized microneedling. You want to give 28 days minimum between treatments to allow that whole, quote, wound healing cascade to run its course before you give another treatment. Yeah. So if somebody was doing them once a week or something, yes, they could cause damage to the skin.
Okay. How deep do you go with microneedling?
Yeah, that's another big topic, and we actually go really in depth in how deep. Basically, there's a very specific place that you're trying to stimulate in the skin to get that response. So more is not necessarily better. I'm going to leave it at that.
Okay, fair enough. Let's see. Which light settings on Celluma do you use for different concerns? Acne versus wrinkles versus dehydration versus scars.
I've played with this quite a bit. The acne, I typically use the blue light setting. And for other people, I've gone back and forth between using the wrinkle setting and using the aches and pain setting. I really do like the near infrared as being the priority in that, because it's wound healing. It helps with the wound healing, and it helps with the inflammation. The red is going to be more of a microcirculation and oxygenation. So some people get a little more pinkened by it. And yeah, that's another one too that's worth digging into that we don't actually cover so in depth in our course, but it's really interesting.
Okay. Last question here. How do you sanitize the equipment? The microneedle machine, jade roller, linens, all of it.
Yeah, you want to use a good disinfectant, a hospital grade disinfectant on your devices. I use Decon 30. There's a number of them. I prefer a natural one that isn't going to be harmful to touch. But definitely there's you need to disinfect everything.
Yes, and with the microneedling devices, there are disposable needle heads. So you use it one needle head per patient and then dispose of it. And with the derma rollers, it's the same. Yeah, that's all I'll say.
Okay. Well, ladies, again, thank you very much for a phenomenal webinar.
Thank
I
you.
can't believe that you guys were able to put up with all that distraction. You did a wonderful job. You really gave a lot of great information. And I want to give a special shout out to Stephen in the back, who's been helping us with this. He was working with delays, and we kept trying to switch files, so it all worked.
Thank you.
Thank you very much for everything you've done. The questions came through. That was really wonderful. I think that to let everybody know, inside the chat room, I did post the promo and discounts for both companies, for microneedling and for L.AC OMS. So you guys can go receive those there. This will be recorded, and you can watch it again on in demand. And there'll be links that'll be pushed out. Let's see. All right. Well, that was it.
Right.
Thank you very much for your time, ladies. You did a wonderful job.
Thank you.
Microneedling and healthy skin. And I wish everyone a good night.
Good night.
Good night.